Joining us now, Director of the Center for Infectious Disease Research and Policy and Professor in the Medical School at the University of Minnesota, Dr. Michael Osterholm. He wrote an op-ed in the New York Times entitled, "Here's How to Crush the Virus Until Vaccines Arrive," arguing, quote, to save lives and the economy, we need another lockdown.
So, Doctor, thank you so much for being with us. I often quoted you from a previous interview where you had said months ago we were in the second inning. I moved that up to the fourth, fifth inning a few months after that. I think I'm back in the second inning. This thing could be around for another year or so. What are your thoughts?
Well, I think you're right. It's somewhere in between there. I'm at the third inning, so we'll split the difference. But I think that, again, just to remind people the context for this conversation, that when you think about all the pain and suffering and death and economic disruption we've experienced to date, only 8 to 10% of Americans have been infected with this virus, and it is not going to slow down until we get to at least 50 to 70%. We can get there through natural disease, or we can get there through a vaccine. We can't count on the vaccine yet being there, and so we have to come to grips with this virus. We have to learn how to deal with it, and we're not. We're ignoring it, thinking that it'll go away, and it's not going to happen.
So talk about why the United States has fared so poorly when you compare us to other European countries. So we're watching Italy closely, Spain, Britain, very concerned. But my gosh, that seems like years ago. Now, of course, we're carrying far more cases than the entire EU. Why have we failed so miserably?
Well, I'll add a caveat to that. 49 states in the District of Columbia have failed. Ironically, New York, the state that was on fire back in March, because of the fact that it did what all these other countries in the world have done, is that when we had such a major challenge back in March, they locked down in a way that they drove the virus down to the point of where it went from a huge forest fire that then was largely contained to now cleaning up brush fires. What we did in the United States, outside of New York, we got to the forest fire at about 80% contained and said, that's enough, let's go. And in May, we gave up. So we went from 32,000 cases a day in March down to about 22,000 cases in May, but hardly extinguished the virus. And then watch what happened. It came back up to 65,000 cases just a few weeks ago. Now we're going to come down again with this short-term, I think, change in how we're interacting with each other. I could see cases being in the high 40s, low 50s till we get to Labor Day. Schools are going to open at the higher ed level. High schools in particular, grade schools, are not likely to be nearly the problem. And we're going to see another explosion, Joe, and it's going to go way beyond the 65,000 level. And we just don't understand that. And the op-ed you talked about that I co-wrote, by the way, with Neel Kashkari, who is the president of the Minneapolis Federal Reserve Bank. So we did marry economy and health together, and we both agree that it's going to be economically much, much cheaper for us to really deal with this and lock down than it is to continue to watch these cases increase for the next 6 to 12 months.
Well, and you've talked about, along with other epidemiologists, other scientists, other doctors, Dr. Fauci, Dr. Gottlieb, people that have devoted their entire lives to following pandemics. You've been warning about what happened in the fall, what was going to happen when the flu season collided with this pandemic. Donald Trump, of course, several months ago said it was going to be gone by the fall. Nobody, no scientist or doctor that I've spoken to agrees. And do you still believe that the fall could actually be the most catastrophic time for us because the flu season is going to collide with this pandemic?
Yeah, well, first of all, we're going to see an explosion of cases in September just related to the reopening of colleges, universities, and high schools. So that's going to be the next kind of big fire line that we're going to have to deal with. The second thing is it's indoor air. Influenza may or may not be a challenge this year. We're hardly seeing any of it in the Southern Hemisphere right now. But I can tell you for certain indoor air is going to be a huge challenge. The more we're together inside, the more we're together with people, we're going to see major transmission issues, these kind of super spreading events that we see. So I do see the fall as being a kind of coronavirus on steroids time period for this country. And that's why we have put forward our plan to say, pay me now or pay me later. If we lock down, get better control like these other countries have done, where they could basically live with the virus in a very different way than we are right now, the only answer. The fall is going to be a challenge.
And yet Mike Pence says America needs college football. Your thoughts?
Well, again, you know, do you want to have bars, restaurants, college football, things like that, or do you want to have schools that you can open more safely? Do you want to have your grandparents and your parents protected in nursing homes? Do you want to be able to have a sense that I can go out in public spaces? So it's choices. It's all about choices. You know, this virus is not making us do anything, but it's allowing us the opportunity to do the right thing. And that's what we keep ended up not doing. And so I think as a public health practitioner here, I'm not the message, I'm the messenger. This virus is the message, and we just don't seem to get it. And so what we have to keep coming back to is there is hope. We can shut this down much, much more than we're doing, but we're going to have to take the medicine to do it. And if we don't, we will pay over a long period of time with a medicine that's going to be much more severe than what we're recommending right now to shut down.
Mika.
Oh, wow. Doctor, so, I mean, obviously, one of your points is another lockdown. And some might say that that will cripple the economy even more. And that will cause hardship, economic hardship, which will lead to mental and physical hardship as well. It's a balance. Are you saying the lockdown must happen in order to save more lives? Because some might argue it's more of a balance in terms of losing lives, losing business, losing livelihood, suicide going up. This is one of the arguments the president makes.
Right.
You know, and Mika, this is a very, very fair argument, and we addressed that in our op-ed piece. Remember, this was written by me as a public health person, but also Neil Kashkari, the president of the Federal Reserve Bank of Minneapolis, who basically made it very clear, because of the increased savings rate that we've seen, this unexpected windfall of going from 8 to 20%, we can finance all of the payment to keep people whole, to keep small businesses whole, to keep state and local governments whole, just through that mechanism alone. No foreign paper, no nothing. So we understand we've got to get us through this. This is an investment in our future by getting us to this point. So if we could keep people paid, if we could keep small businesses from going under, then in fact we're going to accomplish two things. One, controlling the virus, and two, not letting the country sink into this economic despair that you very appropriately lay out. It's true.
All right. Gene, jump in.
Just a quick question. Do you think we will shut down again, or do you think we'll do what we did the first time, which is push it down a little bit, maybe close a few things, shut down again, and then say, okay, we're done, and prolong the agony? Isn't that what we're really going to do, likely?
Well, we are. And, you know, we can say we're Americans and we have this individualism about us and, you know, we do these things the way we're going to do them. We'll be damned what the rest of the world is doing. But we do have to take a step back and say, you know what, New York really messed it up early on. You know, the challenges that they saw there with that house on fire, with the long-term care facilities. And this is not a partisan statement. Look what they're at today. They've gone through almost 10 weeks now of level cases. They've had days with no deaths in the state of New York. This has been remarkable, and they got it right. We should learn from that. So if New York can do it, why can't 49 other states and the District of Columbia do it? So I think that's a message right there. We don't have to try to be like Europe or like the Asian countries. We just have to be like New York, which for many people is going to sound probably, irresponsible to say because we're not like New York. But I believe they are a lesson for us. We can do this.
They are the model. Dr. Michael Osterholm, thank you so much for being on the show this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.